Good afternoon. My name is John Kravitz, and I'm the CIO at Geisinger Health System. And I'd like to introduce Padmanabhan, who is the CEO of Demo Consulting. We'd like to talk about digital transformation for the Geisinger Health System today. Geisinger has been focused in the past on providing the best care to the patient. We've always felt we knew best focusing on the needs of the patient. The trouble is the patient wants to take an active role in the healthcare services. We listened to the patient and began to change the way we provided services to that patient, giving them much more control over their services to request and receive. We focused on wellness care for the patient more than sick care. Our model is to provide the whole care for the entire patient, keeping them as healthy as possible. We focus on population health to treat the patient's needs and focus on the health and care of the patient. Paddy?
I hear all the time, John, that what was supposed to be a 5-year program has been accomplished in 5 months. And COVID-19 has accelerated the timelines for digital transformation. Telehealth, digital health, virtual care, remote monitoring, these are all now going to be the norm for low acuity and chronic care management. Increased interoperability, data sharing is going to accelerate digital health innovation. And I see that CIOs are focusing on transforming their IT infrastructure in order to enable these seamless digital experiences. And most importantly, what I see also, John, is that technology decisions are no longer being made in a siloed or fragmented manner, but they are being made with an enterprise-wide perspective in mind. Now, these charts on the slide are from a CEO Power Panel survey that Modern Healthcare did back in summer on digital priorities for healthcare systems. And no surprises here. The top priority areas happen to be patient-facing mobile apps and telehealth. And electronic health record systems are also very high priorities. But that's not to say that EHR systems are necessarily driving digital experiences. A lot of emerging technologies, digital health solutions, digital front door tools are actually driving digital roadmaps today. Today, with the focus on the consumer and with the focus on delivering care virtually, a lot of emerging tech solutions that involve chatbots, AI, symptom triaging tools, voice recognition tools, they're all becoming part of how to deliver a digital experience to consumers. And increasingly, this experience is going to feel a lot like a drive-through experience. What that means is that patients can now go online to schedule their appointments, to find a doctor of their choice, pick a place where they want to get treated or where they want to meet the doctor, or even do it virtually and make their payments online. If they have to come into a hospital or a clinic, they drive up to the clinic, and because of geo-tracking tools, the hospital administrators, they'll push a notification out to your phone asking you to sit and wait in your car. And when your doctor's ready, you go in, you meet the doctor. You're not lingering in the lobby or anything. You finish your visit and you're on your way. It's going to resemble a lot like a Starbucks experience. You order your drink online, you drive up, you get your care, and you're on your way. So you can see on the chart on the right, too, that consumer experiences, the focus on the patient/consumer is now very, very strong, and there's a renewed focus on delivering these seamless digital experiences online. COVID-19 has become a great equalizer in healthcare. And non-traditional players are moving aggressively into healthcare. What it really means is that the competitive landscape for health systems and for healthcare services now favors digital-first healthcare providers. And you can see, those of you who follow the VC funding landscape, you're aware that digital health funding has been very, very strong. There's a lot of M&A activity, and we're seeing a lot of IPOs as well. So what's happening really in the market is that a lot of emerging digital health companies are getting more and more aggressively into the business of healthcare. So are big technology firms, and of course, all the big non-traditional firms like CVS, Walmart, and Walgreens. The implications for traditional health systems is that they now have to invest in digital health tools and technologies in order to develop these seamless online experiences in the emerging era of virtual care. And very often, these experiences are going to be built in partnership with the same digital health and technology firms that may one day become competitors to traditional healthcare providers.
So the Geisinger digital strategy, and we've looked at our digital strategy vision, creative vision, looking at the organization, looking at our enterprise. Geisinger is consisting of a academic integrated delivery network. So we do have a medical school, we have a health plan, and we have an integrated delivery network as well. So our clinical enterprise consists of 11 hospital campuses and approximately 500 clinics that are part of our organization. So what's important here for us as a whole is we're looking to leverage and enhance new ways of attracting patients or communicating with our patients to make life easier, as Paddy was stating. We're looking to improve the efficiency of the work that we do. A byproduct of that would be growing our revenue. We want to make it simpler for us, for the patient to come to us, someone who they know and trust to deliver their care, as opposed to going to a Walgreens or a Walmart or any other organization that may have that type of accessibility for those services. I like to look at that as the convenience for a flu shot if that's necessary. But again, that data doesn't always go into their record, and we don't know their immunization history if they get them at these other locations. So our goal is to really have value levers that would also enhance care for the patient, making it easier, making it simpler for them to request care, schedule their appointments online, follow-up care, get access to the notes following their appointments. All that information and accessibility of that information is really going to be very important to the patient, and the stickiness to connect them to Geisinger Health System going forward. I'd like to talk a little bit about our digital transformation organizational model. Setting one of these up is the challenge, and this is where Damo has really helped us considerably in Paddy's expertise. We actually have established in a short amount of time a digital transformation office. We've established a governance process as well, because as you see below, there are a number of different areas that support the digital strategy. Obviously, we have the clinic and the patients and the operations that are part of the clinical enterprise. But we have communication and marketing, trying to communicate effectively or target market our patients so they know the services that we offer and how we can provide those services effectively and efficiently for the patients. IT is a major part of this infrastructure because we are the underpinning of all the work that goes on within our digital strategy and our digital rollout for the organization. So these are very important factors that need to be considered when establishing a digital strategy and doing a digital transformation initiative. The technical architecture is important. Things like API integration or an API management platform is extremely important to enable communication and connectivity across disparate platforms. We have a holistic approach to our digital strategy priorities, but I'd like to really steer your attention to the right side of the screen, which focuses on foundational items. Think about, you're building a house. You don't start with a roof. You don't start with the second floor. You start with the basement. You want to make sure you have a good footing, a solid footing in order to build the enterprise on top of that. And in this case, we're talking about our digital enterprise. So important things like, application rationalization, making certain that you've cleaned your application stack to focus on the right applications that you want to integrate as part of the workflow for your patients to be able to communicate with your customer effectively. Project portfolio rationalization is another area. We all tend, just like when you live in a house for a lot of years, you collect a lot of stuff over time. And we are very much similar to that in healthcare. We collect a lot. We have a lot of requests from departments or physicians or whomever else for this specialized software. Is it really mission critical? Do we have an opportunity to clean out our environment to really focus on what's important for our digital strategy moving forward? Contact center redesign, things like that. These are all pieces of it as we go forward, because If you think about the underpinnings of communication across an organization, your customer relationship management solution is extremely important. API integration, extremely important because that gets data to where it needs to get to in a very timely, efficient manner. And if you think about the patient contact center as an example, we will collect some information from patients when we're scheduling appointments or making corrections to their records because someone may have gotten married or moved or something else, and we want to update that information. But they also may want information from our health plan on a Medicare Advantage program that we have to offer. So the folks in the patient contact center can collect some of the information and then pass that call with the information over to our expertise at our health plan, who can go much deeper and provide even further information and get more information on the patient. So the next touch point for that patient will have very good information to make it a connection with our patient or with our customer, so that there is that stickiness, so that we know everything about them in order to serve them better. There is awareness and acquisition. There are other components like care coordination. We're looking at functions and features like a virtual triage model for patients that Paddy was talking about, patients that may call in or video conference in for an appointment and not know exactly where they need to go to for the proper level of care. And this gives us the opportunity with the digital strategy and the digital systems to be able to connect that information and point them to the right level of care, not necessarily the emergency department. That's the most expensive level of care in an organization. And we want to look at where is the appropriate care for that patient to be receiving. We have the patient member engagement as another part of this, and the digital services. So digital services could be something like a contactless check-in process and rooming, especially during COVID. It's been a challenge. We've been working on this. I wouldn't say we have it perfect, but perfect is probably the enemy of good in this case. So we continue to iterate and improve these processes. But our goal is to use digital technology to support these initiatives moving forward. And so this process will continue to refine and get better over time, but it definitely does take time in order to accomplish our goals. So Paddy, I'm going to turn it over to you on the best practices.
So when we started at Geisinger Health over a year ago now, we started from a point where Geisinger Health had already secured board approval for a multi-year transformation program. And this was significant because there was now an organizational commitment to transforming patient experiences and also the back-end IT infrastructure. In fact, among all the health systems that we as a firm have worked with, Geisinger seemed to have all the elements of a comprehensive digital strategy under a single governance model across the entire enterprise. And John's already talked about many of the programs that have been launched and are well underway. And from my standpoint, what was remarkable to me was how much was accomplished in a relatively short time. And an important point to note here is that even though the pandemic struck at the early part of the year, Geisinger did not lose their focus on the transformation journey and continue to remain committed to the transformation roadmap. And we as a firm are really very proud and honored to have played a role in that effort, and bringing about structure, helping with market insights and industry connections. And John's already talked about some of that. But some of the technology architecture choices and the partner choices that Geisinger has made over the past several months or so in accelerating the digital transformation program are going to be paying off in a very big way over the coming years. And a couple of other things, when we talk about best practices, one thing we hear from our clients across healthcare is don't start with the technology, start with the business need. And I believe this was one of several things that helped Geisinger with the roadmap execution. There was always a question of what does the business need and how do we serve the business needs? But at the same time, how do we also transform the IT infrastructure in order to serve the business better? A couple of other things also that we've seen. It's important to leverage existing investments, especially your EHR systems. But it's also equally important to look at other best-in-class solutions and have a governance model that enables you to look at innovation both within and outside the enterprise and look at best-in-class solutions that can be bolted on to your foundational platforms like the EHR system, and then layer on top of that other enterprise class systems such as a CRM system, and look at other transformative initiatives such as data and analytics and cloud and so on. And Geisinger has looked at all of this in a very, very comprehensive way, and I feel like this is kind of a model for health systems out there that are looking at a comprehensive transformation program. And we've already talked about the benefits of a governance model. The one last thing I'll mention here is that I think being agile in the way you manage your transformation is very important, and having the option not just to have a digital roadmap that you're executing to, but also revisiting the roadmap on a periodic basis and to revisit your priorities in order to make sure that all the choices that you're making are going to hold up for the longer term in a fast-changing and a dramatically evolving marketplace is very crucial to ensuring success. And those are some of the things that we learned as a firm working very closely with the Geisinger team. John?
So I'd like to kind of wrap up with the structure and collaborative approach that we've used to deliver significant benefits to date. As Paddy talked about, there has been substantial change. We were very much open to the change in our organization and looking for new ways to do things, recognizing the digital world is upon us. We started this a year ago, well before COVID ever hit. We anticipated, as Paddy said, something to take a few years. Really has exacerbated and moved organizations forward in a couple of months, maybe in some times a week or 2 weeks. So it's pretty dramatic. It gives us the opportunity to really move things forward in a very focused manner. I also would like to point that Paddy brought up is it's not a technology. It's not all about the technology at all. The technology should be there to support the business decisions and the workflows that the business enables and wants to utilize, so the technology needs to support that effectively. But, quantified benefits on this slide, it's very important for, the organization moving into a digital strategy and how we effectuate and measure those benefits. And we know it can be a multi-million-dollar impact. It could be hundreds of millions of dollars impact because of new business that can be generated, because it make it easier for that patient or that customer to be able to receive services at your organization. It can be great for us too, because we have the opportunity to streamline some of the services we provide as an organization. If we can do that and take wasted steps out of a process and improve it through a digital initiative, that's a win-win for the patient and for the organization providing those services. So I think that's really important. We have to lay the strong foundation that we talked about, identifying those core systems, identifying the business needs, and going out to request for proposal to get that type of information and see what systems are available to meet our needs. The improved governance process that Paddy referenced, extremely important, because you can go a whole bunch of different ways if you don't have control over what you're doing and get alignment from the organization on what is really important and what should be next. I'll give you an example. We've done a lot with bot automation, as many other organizations have. And we've gone through, many iterations on vendors to get the right solution for ourselves. And now at this point in time, we've got 24 bot automated processes that are taking processes that were very labor intensive, repeatable processes that now can be automated through a bot. And, when we're doing that, change management, of course, is extremely important in testing and everything else. But it does certainly allow the work to go on beyond the 8-hour day, if you will. And so best-in-class partner selection for improved chances of success are extremely important. That doesn't mean you have to go with the biggest names that are out there, but you need to identify the vendor that meets your specific requirements and understands, the enablement of those requirements. And oftentimes we talk like a customer relationship management solution. Oftentimes you need partners that help you get to that place that you need to get to as an organization. And I think that's extremely important, is identifying the right partners. And, people make mistakes. You think you have the right partner and things don't always pan out as planned. But working with a group like Demo has helped us considerably. We're very appreciative of the work that they do, and we look forward to the future. So thank you.
Thank you, John.
Thank you, John.